Hey again, for fuck's sake. We are here today with India Johnson, pronouns she, her. She is a licensed clinical social worker out of Arizona who also sees patients in South Carolina. Her website and socials are Echo Healing Therapy, and she's been in the business about 6 years. She works with adults and couples virtually in those two states, and she specializes in adult ADHD, which is totally becoming a thing, y'all, as you know, spiritual trauma, religious trauma, and complex PTSD and attachment healing. And her passion is helping to reconnect people with their authentic selves by processing the pain and trauma that has kept them stuck in dysfunctional cycles and letting them unburden themselves from the weight of their pasts. Y también ofrece evaluaciones psicólogas para los inmigrantes con un gran descuento. So she's also helping immigrants who need a psychological evaluation, and she's giving a big discount. And so she's a human's human, people. Welcome, India Johnson.
Thank you so much. I am so glad to be here and so honored to have this conversation with you.
So good. So India and I spoke a couple of weeks ago about collaborating to help our individual patients with each other, since we do very different things. And we just totally hit it off. And so I was like, hey, could you come on my podcast and talk about what you do?
I was more than happy to oblige. Yeah.
So for fuck's sake, you're welcome. Like, look at this beautiful, intelligent woman, and she's going to give us the lowdown on some things.
Yeah, I am really excited to kind of talk about ADHD and religious trauma and kind of how those two challenges really are affected by hormonal health and reproductive health systems. So I think it's really cool that we get to have this conversation today.
It is really cool, and it's really different. And I feel like a lot of people will identify with what you're saying, even though they didn't know that's what was going on. So you're going to peel back some layers of the onion, I think.
Try not to hurt any feelings.
Yeah, peel that thing back and take a peek at them. We got to look at that stuff.
Absolutely.
So I was saying you are based in Arizona, but how did South Carolina? Is that home for you? Second home where you grew up?
Yeah. So no, I have plans to move abroad next year, and I'll be moving to Portugal, which is very exciting. But I wanted to kind of have access to time zones that were a little bit more accessible. I'll still continue to work in Arizona, so that's not going anywhere. But I also wanted to kind of expand my practice to cover some of the East Coast, since that will be the closest U.S. time zone to Portugal. So very excited.
Beautiful. How's your Portuguese? Are you going to be able to help the Portuguese people?
So I'm actually going on a digital nomad visa, so I'm not technically able to work with anybody in Portugal. All of my clients' work has to be sourced outside of the country for the first 5 years that I'm there. But I am definitely excited to learn a new language and all new cultural things, so I can't wait.
It's so different. I thought for sure with my Spanish background that Portuguese would be like Italian or French. And I just kind of, I'd be 60% of the way there with my Spanish. No. It did not work that way. And I couldn't understand, like, why can I read it fairly well, but I cannot understand it. And I certainly cannot make myself understood. And then I went on this tour when I was in Lisbon, and they were talking about all of the different peoples who have come in and conquered and occupied the area and the cultural influences. And I was like, Arabic, that's the thing. Like, this is not totally Latin based.
No.
Yeah. So I was host.
Yeah. If you listen to particularly European Portuguese, it sounds very different than like some of the more Latin based, like Spanish or even Brazilian Portuguese. Like, They sound like completely different languages.
Yeah, I could not figure out in my head why it was so hard, but it was definitely that influence, which makes it so beautiful sounding
Beautiful.
and so kind of lyrical.
Yeah.
But also, I ain't got no idea what's going on.
You're like, keep talking. I don't know what you're saying, but keep talking.
Yes, you can read the menu, and
Exactly.
I'm totally fine with that.
Right.
Yeah.
Yeah.
So I think a lot of people feel like ADHD is a fad, it's the new thing, everybody's just going through a phase of diagnosing themselves. Give us the expert take on that.
I do think, with the advent of social media, more and more people have more access to information and communities. So I think it is kind of a natural byproduct of the age that we live in, that people are able to kind of self-diagnose, or, they see somebody on TikTok or Instagram and they're like, these are the challenges that I face. And they're like, wait a minute, that sounds like me. Why are you calling me out? But I also think we are starting to finally, as a medical field, start to pay more attention to the nuances particular to like women and AFAB people who struggle with ADHD in ways that we just never have before. When we started diagnosing people or developing criteria for ADHD, it was rooted in trying to understand the behaviors of 5-year-old boys in kindergarten.
Right.
And so the ways that ADHD shows up in young girls and women throughout their lives looks very different. So we're starting to see now that women who are in their 20s and 30s and 40s are like, hold on, are you telling me this whole time that has just been ADHD? So yeah, I don't think it's a fad per se, but I do think there's a lot more exposure and there's a lot more clarity and nuance to it, because more people, more voices, more people from different marginalized communities and backgrounds are starting to share their experiences and finding common ground with each other. So yeah.
So it's more the awareness of it. I feel that way about autism as well, where, people are like, oh, what are we doing to our kids? And all of a sudden there's this huge surge in autism diagnoses. Like, so much of that, the vast majority of that is definitely just an awareness of the guardians and parents, of the teachers, of the caregivers, and the physicians. Everybody's paying more attention to it, right? And so then you can spot it, and that way it's not to necessarily make a diagnosis or an assessment, but more like, hey, this might be going on. Here's some tools to help you navigate this world, because your brain is put together just a little bit differently, and you might need some different weapons in your arsenal to get through with this in the best way you can.
Absolutely. Well, and more recent studies are showing that 70% of people who have symptoms of ADHD will also develop symptoms of autism, and 70% of people with autism will develop symptoms of ADHD. So the overlap is getting bigger and bigger and bigger and bigger, and I think, like you said, it's not about necessarily pathologizing people like, okay, you have this now and that's a problem. It's more so about, okay, this is how your brain functions. The world is not necessarily set up for your success. So how do we do our best to equip you with tools, strategies, resources, and skills, so that way you can live the life that you want to live,
Yeah. I think that's actually so great. And what a lovely time to be in this business for you, or this massive growth of research and development and treatments for people that didn't even exist 20 years ago.
Yeah. No, it's been really cool. And I think it's been really interesting also to get a better understanding of how hormones tend to impact people with ADHD and neurodivergence, and trying to better understand, again, those tools and skills and strategies and how we can help people navigate like their menstrual cycle and their period, but also menopause, pregnancy, certain conditions that tend to exacerbate ADHD symptoms, because that's all part of that toolkit that they need if they're going to live the life that they want.
So I'm all about hormones. So say more about that. So like, when you're going through puberty and you've got all these fluctuations of your hormones, and then on the other side where you're having just as many fluctuations in a longer period of time with perimenopause and menopause, how does that influence ADHD and the symptoms that you might experience?
Yeah. So particularly when it comes to like adolescence and kind of early young adulthood, right? You're dealing with those huge influxes and fluctuations in your hormonal cycle, right? So really trying to understand, okay, how do hormones impact the body in general, right? I always kind of lean on the thought that hormones don't necessarily create the problem, but they certainly will amplify them, right? So if you have ADHD and if you're fortunate enough to catch it early on, especially for women and AFAB people, like a lot of times it presents more internally, right? So rather than hyperactivity in a physical way, you might see hyperactivity in their thoughts and their speech and things like that. So if you're fortunate to catch it early, then you can start kind of ahead of the curve. When you get your menstrual cycle, you have 4 phases. So you have your period, then you have your follicular stage, you have your ovulation stage, then you have your luteal phase. Right. Throughout those 4 cycles, those different fluctuations in your hormones are going to impact your ability to focus, impact your ability to stay motivated, impact your energy levels, impact your mood, impact your emotions as you're navigating your day-to-day life. Sometimes you're more irritable. Sometimes you're super happy. Sometimes you're super engaged and motivated to do what you need to do. Other times you want to be a potato and fall apart in a pint of Ben and Jerry's, but you have to live your life and go to school and go to work. And so how do you then start to pay attention to how your particular cycle is going to impact your ADHD, right? These hormones have a huge impact on dopamine and norepinephrine, which are the 2 main hormones throughout the body that are affected when it comes to ADHD. So dopamine rules motivation and satisfaction. Norepinephrine is a stress hormone that helps us regulate like urgency, and that's where like procrastination kicks in. So
call me out like that. Rude. You don't know me.
Right. And I will say, I am also diagnosed with ADHD, so I am riding all these waves with you guys. Trust me.
It's good to have friends in the boat, baby.
Right. So it was kind of my own self-discovery process that got me into understanding how all these things happen, because I needed to function and I needed to stay motivated and I needed to figure out what the heck was going on every week, month, to be able to live my life. So kind of understanding everybody's different. Some people are really affected by estrogen. Some people are really affected by progesterone. Some people are really affected by testosterone. And understanding how those hormones impact each individual person is really important to giving them the best chance. So,
wait, AFABs have testosterone? What?
Yes, indeed. Yes, indeed. Crazy.
That topic is on fire right now. I mean, from Washington, D.C. and beyond. Like, it is amazing to me that people are just realizing that women and AFAB people need and operate on testosterone all the time. And if you don't have it, you're miserable.
Literally miserable.
Yeah, exactly.
Yeah, and what's sad is that, like, if you are, an AMAB person or if you are male, you have access to testosterone through coverage, through FDA approved dosages, through medical insurance, right? Whereas AFAB and women do not have that access. And so it's just very difficult to get access to it in our society, which is sad because we all need it.
And it makes everybody else happy too. Like, if you have ovaries and you don't have testosterone, you're probably not going to be very happy. You're not going to be super functional. You're just going to be slogging through it day after day, just walking through mud, weighing 400 pounds more than you already do. That's how it feels to me anyways when my testosterone levels are lower. So how does that benefit anybody? Like, your friends, your family, your coworkers, like,
we're all having a bad time.
Nobody's going to be happy. So, like, give us what we need. I'm just trying to say it brings the entire community and society up if everybody is working at their optimal level. And this is interesting. So one of my partners just told me that he's on oral testosterone. And I was like, please hold. You can't take it that way because as soon as it hits your stomach, the gastric acid just annihilates it and it can't get into your bloodstream, right? And he's like, I don't know, and sends me the information from the bottle. So of course I go diving into the research on this. It's fairly new. It's expensive. I don't know that insurance is paying for it because they're like, for 1% the price of that, you can poke yourself with a little needle every week, and it's actually more effective and better regulated to do the injections, actually, or the topicals too. But there are some people who don't want to do the needles, and there are some people who just want to take a pill every day. And so the research is still early. The jury's still out a little bit. But then I was looking at the dose that he was on, and then I went to like see what other dosing you can have, and nothing is made for AFAB and women. Nothing. Like the smallest dose that it comes in, and it's in like a capsule. And so it's not like you can score it or half it or anything like that and take what might be a better dose for you. It's in a capsule. So you either take a massive dose that is inappropriate. I'm like, really? Like, if you're going to do all this research and development and make a new product, maybe also let in all the people. Don't you want all of us to be able to pay for it?
Right.
Money for you.
We're missing out on half of the population here.
What? Money for you. I don't know. So at first I was like, oh, yay, another product. This is so great. And I was super excited for him because he feels so much better. And he showed me his labs and this was all great. And then I looked and I was like, damn, we get left behind again right off the bat.
Wow.
No consideration.
And that has just been the trend throughout, all of medical history is just, well, if you're going to give it to women, it's just men, but smaller.
Right.
Just do that.
Just 2/3 ish.
Yeah, if you're going to give 10 milligrams, give like 8.
Yeah.
See what happens.
Just eyeball it.
Like a pinch,
right.
As if this is not, our health and safety and our lives. Like, it doesn't matter. It's so disappointing that we're still, to this day, dealing with disparities like this.
Clawing forward. I mean, I feel like it's just now becoming an actual well-known phenomenon that science has forever left people without testicles behind. I don't know.
Exactly. No.
And actually, there's a bunch of people with testicles, but they also have a vagina, and we won't even get into that. But oh my god, it's gonna take another century to.
Right. Science doesn't even know what intersex people are. They're like, no. Well, and it's so interesting because, when you think about like indigenous cultures and you think about cultures from our history, so much of like healing work and medicine was done predominantly by women. And, when you think about midwifery throughout slave times, like that's done by women too. But then you have the advent of gynecological science and it's all men and no women are allowed, and particularly not Black women. Absolutely not.
Please.
indigenous medicine practices. Get your barbarism away from me, right? It's so ridiculous that we took all of these things and then we just whitewashed it and made it sexist. And we're surprised that half the population is left out of these conversations.
It doesn't matter that this has been going on for 4,000 years. You people clearly didn't know what you were doing. Well, they didn't die out, and they,
Right.
they were
still here, right?
Exactly. It was totally fine until they got destroyed with genocide and poisons, and I don't want to talk about it, but holy smokes. Yeah, it is. Yeah. It has been time. Please.
Well, even oh, go ahead.
No, go ahead.
I was going to say, even within gynecological circles and even within women and AFAB health spaces, there are still so many different diagnoses that are also just not very mainstream. It takes women so long to figure out that they have PCOS or premenstrual dysphoric disorder, which is in the DSM-5, and most people have never heard of it, and yet I think it's nearly 45% of women and AFAB people who have ADHD are also likely to have premenstrual dysphoric disorder, compared to I think it's 28% of neurotypical people. So to not know, yeah, it's almost double the rate. And to not know that that's a possibility and that that's something that you could struggle with, and then you're wondering why you're suicidal a week before your period every month, and you're like, I know I have PMS, but this seems extreme. But when you've never heard of it, how are you supposed to advocate for yourself, let alone figure out how to navigate it?
Yeah, I think you just sit there and think, I'm feeling crazy and I don't want to talk to anybody about it, because then they'll know that I'm crazy, and then that kind of just solidifies the fact that I'm a nutball. And it's no, these are your neurotransmitters actually screwing with you and not acting in a way that is functional for you. And awareness and diagnosis is the first path to freedom, right? You have this thing. It is very clear. Now what do we do about it? Instead of just sitting in the dark wondering how come your brain is basically just sabotaging everything about you.
Yeah, absolutely. I think it's very easy to stigmatize ourselves, to gaslight ourselves, to say, okay, well, I'm the problem. I just can't function, which is a huge issue with ADHD in general, right? I'm just lazy and unmotivated, and I can't stay organized, and I can never tell how much time has passed, and I'm unmotivated, and so I guess I'm the problem, and I just need to figure out another planner and another system, and I'll get another app and I promise this time I will respond to the message and I will set the timers and I will listen to them when they go off. And so we just keep trying and trying and trying, and then we're like, what is going on? I don't understand how everybody else just seems to do life and it's fine, and I'm over here falling apart every week. So it's very easy to dismiss ourselves and not get the help and support that we deserve.
It's true. And I think the easy part is you can just be quiet about it so that you don't have to reveal your darkest fears. Mm-hmm. But the flip side of that is the freedom of bringing it out into the light and talking about it and getting more tools and having more resources and just having the awareness of, I am not the only person who feels and thinks this way. There is a whole scientific reason for why this is happening. I am not a lazy piece of shit. I am not worthless. And then get help and actually have the knowledge of what that looks like. And so it's brilliant work that you're doing with that. So that, even just that, it goes so well with the psychiatric part of being depressed and anxious, right? If you're feeling super badly about yourself, you're not getting the stuff done that you know that you need to get done. And you're sitting in the dark with all of this. How are you not going to be depressed and anxious?
Yeah, absolutely.
Right? So they're just tied together.
Yeah, there's so much shame, you know, and I think a lot of times, particularly because, you know, women and AFAB people are significantly more likely to have a late diagnosis and not know that they have ADHD. I often find that, and this is purely, you know, anecdotal based on what I've seen in my practice, but they either tend to be really, really good in like their primary school education, right? They got all A's. They were just like on top of things. They were in the gifted program. They were amazing. Then they get to college and then they like kind of fall apart because of the different way that college is like structured. Or they really struggled in this like hyper structured environment, and then they get to college and having more freedom and autonomy over their schedule gives them kind of the boost that they need in order to like really thrive. That was me when I was in college. I was like, this whole school thing is really hard, and then I was like, oh, I could do this. You know, so but, you know, depending on how structure helps, right, it can take a long time to get that diagnosis, to get that understanding that this is a problem. Then you get into adulthood and you have like no structure. You're just like, okay, I'm supposed to wake up and go to work, and then I'm supposed to work out at some point, and then I'm also supposed to cook meals and walk my dog and take care of bills and pay taxes. And also like, so having all of that freedom is very dysregulating for the ADHD system. So it's just hard. It's just very hard to recognize that this is what's happening. And without that kind of lens to see yourself through, it's so easy to say like, well, I was just a gifted kid who burnt out, and now I'm just a flailing adult, and I'll never figure out my life again, and I'll never be successful again the way I was when I was 12, you know? And so it's just really sad, you know? So it's hard.
Adulting is so tough anyways.
As it is.
With a brain that works within the constraints of what's expected of you. And then, you know, you're talking about nearly half the population who is not wired that way at all. Yeah. And then people like yourself are there to be like, I understand, I empathize, and here's some tools that will work for you now that you understand how come this relationship is not working between you and adulting.
Yeah, no, it's
Brilliant.
So liberating when you finally realize like, oh, it's not my fault. Like, it's my responsibility, and I need to be able to like learn how to navigate this, but it's not like a moral failure, which I think so much of individualized capitalistic Western society is like, well, if you've got a silly life, then, you know, you're just a silly person because you just can't seem to get it together. You know, so this takes a lot of that pressure off. And then, of course, when you understand that you are more likely to have a premenstrual dysphoric disorder and things like that, then you really get the clarity of like, okay, so I need to start structuring my life in accordance with how my hormones are going to shift throughout each month, and trying to figure out, okay, when I'm in this stage, can I be more productive, more active, more social, more focused and energized, right? And then can I also be a little bit more gentle and compassionate and patient with myself, and maybe take a few things off my plate during these phases, so that that way I'm working with my body rather than trying to like muscle through with hustle culture, like, you know, dude bro self, you know, help advice that has nothing to do with you.
Right.
It's just
Get those
not
boots
going to help you.
and tug on them. It's like, I'm not even wearing any boots. I don't know where the boots are.
Yeah.
Oh
pull what bootstraps? Straps? There were no straps attached to my boots, and my boots are falling apart every step I take.
Right.
So
then,
and I lost them.
if a lot of this, especially the PMDD and the enhancement of ADHD symptoms, is related to hormonal fluctuations, what happens in perimenopause and then in menopause? Do things go like completely haywire because you don't know how to structure yourself because your cycle isn't regular? And then with menopause, is it like nirvana because you no longer have to worry about those cycles?
Yeah, pretty much. So my recommendation is always to start paying attention to the very nuanced ways that your hormones can change, right? Because this is not just specific to perimenopause, menopause. This is also really helpful for people who are ADHD, autistic, with PCOS or endometriosis or things like that, right? So people who have irregular cycles do find it much more challenging to figure out how am I supposed to move with my body, right? But there are so many different symptoms other than just, well, I had my period this week and now I know that I'm in this stage and I know that I'm in that stage. You can track like your physical changes, whether or not you are bloating a lot more during a certain period of time, or whether or not you are more sensitive to emotional dysregulation, whether or not you have more breast pain, or whether or not you are sleeping more, lack of motivation, feeling less enthusiastic or creative, or maybe you're introverted one day and then you're more extroverted another day, like your energy levels, all those other things. You know, you can even look at like vaginal discharge, things like that, to kind of track like, okay, I think I get a sense that like when this is happening, I probably have higher levels of progesterone in my system right now. So how am I going to adapt to that? Or I think when this is happening, it tends to mean that I have higher rates of estrogen in my system. So how am I going to adapt to that? You know, using certain apps that protect your privacy, that allow you to kind of track like more nuanced symptoms of your menstrual cycle can be really helpful. So pelvic pain, breast pain, you know, headaches, nausea, migraines, things like that, right? All of those are connected to your hormonal system, and being able to keep track of those and notice patterns that relate to you can be really empowering.
Nice. Yeah. And then menopause, everything is good because you're no longer cycling?
I would say it's definitely easier once you get to the other side, right? I mean, obviously going through it, not always fun, you know,
Not fun.
Definitely a roller coaster, right? But again, you can kind of strap yourself in with more of that knowledge is power, right? But then once you're on the other side, you do have significantly fewer fluctuations in your hormones. So you are likely, you're still going to have ADHD, like that's not going to change, right? It's your brain and how it functions, but your hormones play less of a role in terms of how it's going to affect your symptoms. So you might have more stable levels of dopamine. You might have more stable levels of norepinephrine. You might find yourself, you know, having a bit more stability in like your motivation and your energy levels, you know. So, yeah.
Okay. And then if you decide that you are going to treat yourself with menopausal hormone therapy, or previously known as hormonal replacement therapy, do you find that that's of benefit for people who have ADHD and autism?
Yeah, I think that hormone replacement therapy, or again, being able to kind of supplement your cycle, whether it's before menopause or after, is starting to gain more scientific research, and so it's still something that we're trying to study more, as we should.
As we should.
But, you know, depending on the person, again, figuring out, you know, are you more sensitive to estrogen, progesterone, or testosterone, and finding ways to supplement things. You know, they're even starting to do more research for like postpartum depression, especially when it comes to like the placenta. You know, there are like 4,000 mammals in the world that naturally like eat their placenta after the baby is born to improve like hormonal health. And the verdict is still out when it comes to humans, but you know, there are people who are starting to think like, hey, this whole gigantic endocrine organ that is filled with different hormones for baby and mom, maybe we could use that after you lose it and now you are in depression. Who'd have thought that removing a giant hormone would cause that?
Right? It's such a taboo subject because people are like, oh, it's cannibalism or whatever. And I'm like, oh, I don't know that that's necessarily true.
No.
And so many indigenous peoples have been doing that, like that's the thing is you grab that placenta and you make a soup, especially for mom, but for the entire family, because it's kind of a spiritual evaluation of what just happened. And obviously I do not deliver babies and I never wanted to deliver babies, but I delivered some babies in my training. And there were a few families that came through and signed, they had legal paperwork saying that they got to take the placenta home with them. But they had to go through hours and so much energy and effort to make sure that the hospital didn't throw that thing in the incinerator. And it's like, what's going to, who cares?
Yeah.
Who cares what they do with it?
Right. Like, it's not up to you, there's some research that's showing that, it's good to increase breast milk production, and it's good to help with weight gain in newborns and decrease fatigue and increase mood for moms. But, there's also some research that is concerned about potential for like bacterial or viral infections if it's not handled properly. It is an organ in the body, so you want to make sure that it's really taken care of. And, that it can, depending on how you prepare it, whether you consume it raw or cooked or dehydrated or capsulized or processed, there's some disparities around whether that's as effective or if there's potential risk for contamination or trace elements of things. And so it's still very new, but, has the potential to maybe offer some relief.
Yeah, I think the studies on that are going to be super fascinating. I can totally see why, because that's supposed to be a sterile environment, but there's a lot of instances where it becomes an unsterile environment. And then certainly you wouldn't want to take an organ that was steeped in that for months and months and months and ingest it. But most times, it is going to be a sterile product of your own body. So what's the problem with that? I found it fascinating the first time I came across that, but I wasn't grossed out by it. I was just kind of curious, where does that come from? I have never heard of that before. And then one of the families schooled me on it. They were Native Americans outside, actually in Arizona. And just, superficial, this is our belief system, and we believe that this, that, and the other thing are contained in the placenta, and it's important for the mom, the baby, and especially the surrounding family to take part in that. And I was like, okay, now that's kind of beautiful, and I don't know what to do with my own thoughts.
Right. No.
Yeah, but thinking about it from a physician standpoint, I'm like, unless they had premature rupture of membranes or there was a strep infection, or I'm like, why not? Who cares? We eat beef tongue and liver and gizzards and all sorts of stuff from other animals. Then you don't know how they've been handled. At least this thing was in your belly and you knew exactly what it was exposed to, right?
Exactly.
Weird.
I think that, like all things, the more research that we have and the more we start to try to understand this, the better we will be able to use that knowledge, but because we are so dismissive and we don't necessarily research these things and we dismiss them as, cultural differences or belief differences or things like that, then we miss out on the potential to really help people in a very natural way that doesn't need SSRIs and, crazy treatments. No, just eat your placenta after you give birth and you'll be fine. Oh, okay.
Right?
Cool.
I'm sure most people who have had postpartum depression would be perfectly happy to take some of those capsules every day if it meant that they could feel better and have proper bonding with their child and engage in the family again. I don't think too many of them would succumb to the ick factor.
Yeah, they'd be like, okay, tell me when, tell me how. Exactly. Let's figure it out.
What pharmacy do I go pick this up at?
Right.
Of course, I want to talk about sex.
Yes.
So, You help individuals and couples with intimacy discrepancies. And some of that is based on trauma from cultural differences, religious trauma, things like that. Can you talk a little bit about that?
Absolutely. Well, before we pivot to like the religious side of things, because I'm very excited for that conversation, but one more tap into the ADHD conversation when it comes to sex is the prevalence of like hypersexuality and hyposexuality in ADHD. You know, in terms of like the prevalence, I think it's like 25% of people who have like adult ADHD also struggle with hypersexuality. So there tends to be a higher rate of sex drive within the ADHD community for different reasons. Some of it is like impulse control, although recent studies are starting to shift away from that being like the main cause, you know, which I think is good because I think that can also kind of be stigmatizing or
completely,
pathologizing. Well, you just can't control yourself, so obviously it's like
right.
Calm down. You know, ow. Right. But a lot of it is starting to show that a lot of it is about like essentially like maladaptive coping, right? Whenever there's a lot of stress or whenever there's a dip in motivation or in mood, when we're struggling with depression, when we're struggling with fatigue, and you know, things are just really challenging. Sexuality and being able to engage in pornography usage, masturbation, sex with our partner, like lots of feel-good hormones in there.
So
right?
soothing to get that pleasure, right? Yeah, it's like your own little staycation of your brain.
Yeah, it really does kind of like shut off all of this and get you really into this and allow you to be more present, allow you to get a spike in dopamine, get a spike in serotonin, get a spike in oxytocin, you know, and so all of these things are really important in being able to like improve mood, improve functioning, improve focus, right? So all of these things really tend to help in those situations. So that, and then I think when it comes to hyposexuality, a lot of it is kind of tied to the different types of medication that ADHD people tend to have to take. Ritalin in particular has been known to kind of affect like erectile functioning in men and AMAB people. And so struggling with some libido challenges there can be kind of hard. But yeah, so there's definitely some impacts, particularly also in relationships, right? When you have like one person has ADHD in the relationship and the other person doesn't, sometimes that can lead to like a hierarchical issue where like one person would start to feel more like a caretaker, you know, like, did you bring your keys? And did you make sure that you scheduled that appointment? And did you make sure that you picked up Susie from soccer today? And did you make sure that you picked the lunch? And did you make sure that you know what I mean? That like constant kind of checking to help the person with ADHD navigate their symptoms. And so that can obviously create a lull in sexual intimacy within those relationships as well. So
yeah, like that friction can't feel good on either side of it. It's like, oh, you're just nagging me, and so I'm not feeling very confident or sexy in myself in relationship to being nagged by you. And then the person who's trying to keep on top of things is like, I'm exhausted from having to take care of me, take care of you, take care of all the things. And so now I don't want you to touch me.
Yeah, absolutely. Yeah. So trying to figure out that balance is really important. And then if you have two people who have ADHD, then you're really trying to ensure that they're both functioning at like their optimal level. Or if you have someone who has ADHD and one person has autism, really trying to create spaces that feel nurturing, safe, comfortable for both people, and all of their lovely nuanced manifestations of the disorders, so that way they can, you know, function well together. So, yeah.
Right. And each one of them is going to bring their own baggage and trauma. Well, we all do, right?
All of us.
Yeah, exactly. Drag those bags. But I can
But
see how that could lead to a lot of experience in feeling shame or lack of confidence in yourself.
for sure. For sure. Speaking of trauma.
Yeah.
When it comes to trauma and sexuality, and particularly I think the branch of like religious trauma, and really trying to navigate that from like an attachment lens, right? We are dealing with in a lot of like, especially like evangelical spaces or even like Mormon spaces or LDS spaces, there is kind of this fixation on God or like a divine figure as like a father figure, you know, which creates this like attachment. And a lot of like purity culture would sometimes encourage girls or young girls to attach to God or attach to Jesus in this very patriarchal or even like romantic way, like doing, you know, purity balls and things like that, wearing a ring on your finger that signals that you are like married to God, or that you are married to Jesus until your husband comes over you, or that your father has dominion over your sexuality and your ability to navigate your virginity, which is also a social construct, you know. So there's so many little layers of religious trauma that just make it so hard for women and AFAB people to stay connected to their own internal experiences of how their sexuality is flowing through their life, right? And a lot of it, you know, you start very young, right? At like 10, 11, 12 years old, you're already starting to tell these young girls, like, your sexuality, your body, your feelings are not your own. And if you think that way, then that's wrong. You are succumbing to the devil. You are not like allowed to think about these things, right? And so you really end up externalizing a lot of that. And then when you do experience it, you just end up like shame, you know? So when you do that to a person for a decade or 2 decades, then it becomes very difficult to start untangling that once they get married. You know, let's say you do it right. You wait until marriage. Okay. Right. You did it the right way, God's way, right? Okay, fine. So let's say from age 12, you have decided you're going to wait until you get married to have sex. Maybe even wait to like kiss until you're married. Some people do that, right? And so, yes, right, exactly. And so let's say you do all of that and then you're 25. It's been 13 years that you have been processing your sexuality through this externalized, very shame-based way. Now you get married and you've been told all this time that sex is beautiful and God loves sex, but only in the confines of marriage between a woman and a man. Okay. And now you're just supposed to what? Turn all that off and turn on your sex drive and turn on your libido and turn on all of the things that you've been repressing for a decade and a half to then go and have the best sex life ever.
Yeah.
Yeah.
Yeah. It's not a sin anymore. You're off to the races.
And they're like,
discombobulating.
Okay. Yeah, it's extremely disorienting, right? And then you're trying to learn all about your body in the presence of another person. So that's a thing.
Yeah.
And you're like, I don't even look or touch down there. So like, I don't know what you're going to find. Maybe some cobwebs and some, you know, dust. Yeah, exactly. You know, like there's a lock downstairs, you know? And so it's just, it's extremely vulnerable. It's very disorienting. It's very, that's what I'm looking for. Like disembodying, you know, to then go from like 0 to 100. You've essentially spent a decade of your life like dissociating from that part of you, and now all like it's a rush of things happening, and you know, so it's just really hard.
Especially
It
since
tends
those are all your developmental years where you're supposed to be exploring your body, which has been changing so rapidly. You are definitely not the person that you were even 2 months ago sometimes. And you're not allowed to look at that or really experience that in any kind of developing way to explore. And I guess you're just supposed to put that out of your brain because it's shameful and sinful. And then all of a sudden it's like, boom, you're Marilyn Monroe. That's not going to happen.
Yeah. Went from the Virgin Mary, literally,
right,
to Marilyn Monroe. And also verses in the Bible that are telling you that you cannot deny your husband sex and that you must submit to your husband at any given time. And that you're not allowed to say no. Like all these things that are constantly being thrown at you. And of course, up until you experience it, you're like, well, why would I ever want to deny my husband sex? Like it's going to feel amazing. Everybody tells me that it's going to be the best thing ever, that it's like heaven on earth and God designed it for all these beautiful things, right? Okay, so like I would never want to. Except
maybe your progesterone's really high and he didn't do the dishes and he forgot to pick the kids up and the house is a mess and you're excited and you're just exhausted and he comes at you and grabs your boob and you're like, I don't think so.
Exactly. But that's not God's plan. So don't say that. Exactly.
Call me, I'll say it for you. You just I'll translate.
Your wife is being very gracious right now by calling me because she doesn't want you to hate her, but you can hate me, so that's fine.
And here's all the reasons why.
Yeah. So I mean, it's really sad, but unfortunately, because of all of the stress of years worth of shame relationships with our bodies throughout purity culture and religious trauma, right? There's an increased risk of anxiety, panic, dissociation, fawning, freezing, OCD, scrupulosity, specifically with that, guilt, depression, self-esteem issues, right? All of these things are really prevalent, which then make you significantly more likely to experience things like vaginismus, vulvodynia, really not being able to connect with your body, pelvic floor issues that you're not even aware of, and so all of those things, right, are obviously going to not only have a huge impact on your self-esteem, especially if you were the person who was like, I waited, I did all the things, I followed the plan, I listened to all these people, and they told me that this was going to be incredible, and now here I am, and me and my husband can't even have sex because my vagina spasms, and I have no lubrication, and now what? And now I'm supposed to go to a doctor, and they're the only other person who's ever seen my vagina, and I'm supposed to just spread my legs and be like, I'm having issues. I don't know what they are,
right?
But I'm having them.
How do you even give voice to that? You don't even have vocabulary. You're not going to have the wherewithal to even explain that to the provider if you even get there. Like, I'm sure most people just clamp their mouths as hard as they do their pelvic floors, and they're just not even going to talk about it.
And that, particularly in religious spaces, what's the number one rule of advice? Give it to God. Pray about it. You don't need to talk to a doctor. You just
better
pray.
Send some angels with some dilators and
and some lube. It's very sad, and when we talk about language, right, a lot of that has to come from education, and in these spaces with religious trauma, we know that they're significantly less likely to have comprehensive sex education in those areas. So from a young age, not only are you being indoctrinated with all of these ideas about how God views sex and how much shame you're going to do it, but you have nothing to stand up to that with when it comes to the secular world, because you're in school and your school is only teaching you abstinence. And your school is giving you misinformation. I think there's a study that I read that said somewhere between, I think it was like 70 or 80% of like the information that is in these like religious based sex education programs is like just wrong information. Like
Right.
they're telling people that like condoms have a fail rate of like 14 to 50%. So they're like, see, you can't trust condoms. Just don't do it. Don't do it because, you know, up until you graduate high school, they fail at 14%. And then by the time you're an adult, they fail at 50%. And you're like, what sense does that even make? That doesn't make sense.
How does that change? Like all of a sudden you're older and it's worse?
That's literally what they tell people. They're like, well, when you're an adult, it gets worse, actually. The condom can tell that you are 19 and not 18. It has a little sensor on it. You know?
You have an expiration date with your condom, not the actual condom.
Right. Right. Yeah. Exactly.
It's the penis.
The date on there is... Yeah, it's actually the date which it knows that you are no longer a child, that you are an adult. So yeah, like 80% of the educators are spreading false and misleading information in these courses to convince people to just stay abstinent, you know? So it's just really disturbing because you have nothing to combat what you're being told. And then you know nothing about your body. And so you have higher rates of pregnancy, higher rates of STD, higher rates of, you know, significant sexual dysfunction that you don't even have words for. And then all you can do is just pray about it and hope it goes away.
I have a lot of violent feelings about this right now. So then exactly. Do the women AFAB come see you, or is it couples or both?
Mm-hmm. Yeah. Unfortunately, I tend to find that it is like couples, but it's always like the man kind of coming in and being like, we're not having sex and that's a problem.
Right. It's her fault. And we're here so you can fix her.
Mm-hmm. She always has headaches and she's always tired and she doesn't initiate. And I think it's because she just doesn't, you know, women are just inherently less sexual, obviously. So I think we have an intimacy issue that she needs to fix. So that's what tends to be the case, you know. And the fact that they even end up in a therapy office that is not a pastoral counselor's office, that is not a church office, like is already a huge step, right? So we could be very grateful when they end up in an office like mine compared to an office like that.
I mean, I figure they've already been there, right? Like they've probably been doing that for a couple of years and shockingly have not had any resolution of the situation because they're probably just being told, like, you know, the guy says she's not doing these things, and then the pastoral person, who probably also has a penis, turns to the woman and says, you just need to give it up, essentially, right?
Yep.
Just get past it and do the right thing under God's eyes.
Yep.
Yeah.
There's a lot of like, well, you guys should do a challenge. Just have sex every day for the next 30 days and see how that improves your intimacy. What are you saying? What are you saying? Like, that's like being like, well, you know, I got into a car accident and I'm feeling extremely anxious and extremely traumatized and I don't think I ever want to drive again. And someone's like, you know what you should do? You should just get into a car accident every day for the next month and then see how you feel.
Exactly. Just go ahead and desensitize yourself from the trauma that you have already been through, add to it, and see if you break. See if,
you know.
Yeah. Okay.
Thank you. Now I have DID. So here we go. Now I'm just so dissociated from myself that I've just created a whole separate person. Like they can deal with the car accidents.
I'm going to send them out driving while I stay home in my safe little place and suck my thumb.
Exactly. Yeah. So like these are the advice that they're getting, you know, just confront it head on, even if it hurts, even if you're tired, even if you're sad, even if your husband does nothing about the mental load or the emotional load in your household, even if they couldn't be bothered to pick up the kids from soccer every week, like just keep doing it. That'll help.
So I almost don't even want to give voice to this, but I'm so curious. Are there men who come in with religious trauma such that they're unable to perform? I hate that word. because they have so much shame and because they haven't really explored themselves. And now all of a sudden there's all this pressure for progeny and to perform for their bride and all this stuff. Like, do they come looking for help?
Yeah, I mean, unfortunately, I think, because therapy is still so stigmatized within male spaces, they are less likely, obviously, to seek out, support, particularly for something so vulnerable and so personal and so tied to their masculine identity. But I do think that on the flip side of the religious trauma for men, the way that tends to show up is like a gross over exaggeration of like porn addiction, right? 9 times out of 10 when I'm assessing a man or a couple and I'm asking things like, okay, what's your relationship like with sexuality and pornography? And they come from a religious space. 9 times out of 10, they're like, well, I struggle with porn addiction. And I'm like, define that for me. Because for some spaces, if you watch porn one time in your life, ever, you have a porn addiction, right? Yeah, because that is the messaging that they are receiving. Like, you should never, ever watch pornography. You should never, ever masturbate, when we know that women are multi-orgasmic beings. Men are far capable of being able to masturbate and still function in society, okay? Like, it's okay. You don't have to go no-fap in order to be able to start a business. That's just not how that works. You can have a business and also masturbate once a day. You're fine. So, there's so much, again, just stigma and shame around being connected to your body. And so for men, they're being told that, if you masturbate and you watch porn, then you are a sex addict, as opposed to like, no, there's definitely a threshold that you have to meet in order to be considered an addict. And just because you watched it once or twice when you were 13 does not mean that you are an addict. You're okay, So there's just a lot, and I think when it comes to like the performance aspect of things, again, when you've been told so many times that like to lust after a woman means you should cut your eyes out.
Right.
Okay. Yeah. Dramatic.
A little too much on the pressure dial. Like, dial that down 68 notches and calm yourself.
Yeah, it's okay. We don't have to gouge our eyes out because we think a person is pretty. That's okay. But, when you're being told that like to experience any kind of sexual pleasure for anyone who's not your wife ever is this horrible sin against God, then, you really shut down your body's natural response to arousal, to being able to experience desire. And we know that like those are the two like gas pedals that you need. You need arousal, you need desire if you're gonna have sex. And so if you've shut down, if you ripped the desire pedal out of your car and then you smashed the arousal pedal and then you're like, I'm ready for sex now.
You can't drive this car.
It's not working.
No, it's not working. Nothing's working.
Because you've conditioned your whole system. When I have this thought, it means it's bad. It means it's shameful. Do not send the blood flow. Do not wake the beast. Do not allow this to happen. Then your body's like, okay. What do you want from me?
God, it's so sad.
It really is.
And then so much time lost trying to undo all of that psychological trauma so that your body can do what it was supposed to do naturally in the first place.
Exactly.
Oh.
So your early marriage years that were supposed to be newlywed bliss and were supposed to be so fun are spent going to pelvic floor therapists and gynecologists and learning how to have a healthy relationship with your desire again, and learning how to masturbate and looking at yourself with a mirror for the first time and learning how to jack off, like all these things that you should have been able to explore and play with and get to know and understand about your body 10 years ago, you're now trying to do with yourself, with your partner, in your new marriage, and it's just not working.
instead of in your own room, under the covers, with a flashlight, having a good time, trying to keep your voice down. Now you're laying next to the person that you're supposed to be with for the rest of your lives, and neither one of you knows what you're doing. And you're scared to do it. And you're scared to talk about it. And you're scared that God is watching you. Oh my gosh.
Yes. Jesus is sitting in the corner.
Not with a camera, because that would be porn. But
no, absolutely not. Yes. Watching you guys struggle to have sex, and then you're like, like, what kind of a sex life is that?
God.
It's horrible. And when we think about like really extreme, versions of like fundamentalist religious communities, we are also dealing with things like female genital mutilation. We are also dealing with things like male genital mutilation, which does not get enough, I think, understanding and visibility that, circumcision is a form of male genital mutilation that we have, made into this religious spectacle. And we just think it's very normal, particularly here in the US, whereas like other westernized countries circumcise their boys at significantly lower rates than us, because we, they kind of recognize like, maybe it's not a great idea to be cutting things off of little baby penises. And maybe it's not a good idea to be sewing women shut or to be cutting off clitorises. Like, why are we doing this to babies and girls? Like, why are we doing this? And then they're still expected to perform and to experience pleasure and to experience connection. It just doesn't work, Leave the bodies alone. Leave them how they are.
Yeah, I can see that. It's so, I definitely have a bias coming from being an emergency physician for so long, because we would see tons of complications from babies being uncircumcised. But in hindsight, and getting a little distant from that, first of all, we're not seeing all of the little penises that did completely fine being uncircumcised because they're not coming in. No one's crowing about it.
Show you that it's fine. Actually, yay! Okay, goodbye.
I was uncircumcised and life is great.
Gold star for good job cleaning that, mom and dad.
We're like super jaded for that. And then the other thing I think is that because we come from we're in this puritanical society with tons of holdover from all of that and shame about genitalia, is that like a lot of the other westernized countries that aren't circumcising their boys will actually talk to them about their penises and how to take care of their foreskin. We're not going to do that, because then we would have to be acknowledging that someone has a penis and that needs to be cleaned, it needs to be taken care of, instead of just like, oh, we're just not going to look at it. This is just a sign of lust and horror and God hates it. And so, the vast majority, like so many more circumcisions are done. And like, I circumcised my kid because I was like, I'm not ending up in the emergency department with it all stuck and macerated and blown up and infected and all this kind of stuff. But in hindsight, I'm like, if I had had the gumption to buck societal norms and actually teach my kid about his penis and how to take care of it and how to clean it, it would have been totally fine. So, that's totally a thing.
Well, and it's so sad because, like you said, it really is just about education and understanding and knowing, like when you grow up in a society that teaches all their boys, like, this is how you clean your penis effectively to ensure that you don't end up with big cheese in there and it doesn't get stuck. Then here we go. Like, it's okay, but when you grow up in a society that, is extremely homophobic as well, like, I am a dad. I'm not going to touch my son's penis and make sure that it's clean. Why would I do that? That's gay.
That's gay.
Sir.
Yes.
Sir, you need to clean your baby's genitalia. You need to clean it. And you need to clean their butt too. And it's not gay. It's just hygiene.
Oh my God.
and girls too.
Yes. We teach them we potty train them. So at some point you are talking to them about their bodies and their genitalia, and they don't have any shame about it until we introduce that to them. Right. And so they're going to think it's totally normal until they are told otherwise. And we're the ones doing that.
Absolutely. And even when you think about just like the way, particularly around bathroom etiquette here in the US compared to other countries. Like when you go over to Europe, it is very common for you to walk into a bathroom and you see a toilet and you see a bidet, whether it's a separate thing that you sit on or a hose out of the wall. Like, can you imagine how much easier it is to teach children how to effectively clean their, undercarriage when you have this machine that sprays water everywhere?
And it's fun. It's super fun.
Exactly. It's very easy to teach your kids how to clean themselves when you have something like a bidet. And we just use toilet paper. That's it.
And then your hand goes through it and it gets all weird. And now you're like, oh my God, it's on my hand. And I'm freaking out.
I wouldn't want to do it either. I'd be like, ew, I don't want it here. What? I'll just leave it down there. I don't have to see it down there.
Yeah.
So,
let's just ignore girls, it altogether.
The amount of I saw this video of a wax technician, and she was sitting in her car. She's like, ladies, we need to have a chat. I am not here to hurt your feelings, but I can tell which ones of you know how to effectively clean yourselves, because I see it every day.
Oh, Lord.
Can you imagine? You show up to work every day to wax people, and that's what you got toilet paper strips, you got fecal matter in places that you shouldn't have it. But people just don't know how to do it, because again, we don't teach each other, and it's so riddled in shame. And it's so riddled in puritanical residue. And it's so riddled in homophobia and sexism and racism. When we think about, Black women and how often they are seen as dirty. And then you throw on a layer of religious trauma that tells you not to connect with your body. And also you throw on, stress, and you throw on self-esteem issues. You are left with a woman who either is extremely OCD about ensuring that her hygiene is tip-top notch so that nobody can accuse her of being this stereotype. Or you are left with a person who just has zero idea how to take care of her body. I knew a person in college who didn't know how to put a tampon in properly.
Yeah.
In her 20s.
Oh, yeah.
Because nobody taught her.
Women my age who think that they only have 2 holes. And I'm like, what?
Honey.
We can't count to 3? You can put a tampon in and still pee and poop.
Yeah. Yes.
That's 3 things.
There are boys who think that girls only have 3 holes or 2 holes. They're just like, how do you?
At least it isn't their anatomy, though. But I'm like,
right?
Oh my God, I don't.
But this is what affects laws. There are men in Congress. There are men in our government who think that you don't have to period everywhere. Hold it in. Hold it in like your pee. Obviously.
Yeah. I was actually shocked to learn that pigs can. Isn't that crazy, India? I owned a pig for a little while. Yeah. And one of my friends was like, aren't you going to get her fixed? And I was like, why would I get her fixed? It's not like she's going to roam the neighborhood and a rogue male pig is going to come hump her through the fence. That's not. She's not a small dog. And he looked at me and he goes, oh, I'm glad we're having this conversation. Pigs menstruate every 24 to 28 days, just like humans, which I found very interesting because dogs and cats don't do that. And they have hormonal changes that give them a terrible temper every time they menstruate, which made me giggle and also call the vet to make an appointment. And I said, oh, and I bet the blood just gets everywhere because my pig was indoor, outdoor.
Yeah. Okay.
And he's like, oh no, actually they can take it outside. And I was like, what are you freaking, this is a physician. I said, what are you talking about? And he's like, no, they can actually, they hold it and they expel it. Like their sphincter and their pelvic floor must be a lot different than ours. And I was like, that's a friggin' miracle. That's awesome. And also, I'm getting her fixed. How early can I do it?
How do we evolve in like that direction? How do we make our anatomy also go that way? Right? Can we? Is there a way to do that? Can we?
We're gonna have
Darwin?
to talk, right? Darwin left that one out. And honestly, like I have to assume Darwin also had a penis. That would have been a really good thing for like us to be able to control the tightness of our vaginal sphincters even stronger. Ooh, imagine that. That's kind of fun.
Part. Yeah.
But no, we don't have that. That's the weakest part of our pelvic floors, unfortunately.
Yeah. Somewhere that train turned off the station. We weren't on it. We missed that stop. That's fine.
Sorry. we all played hooky that day from training.
The entire female side of our species is like, who needs that?
Right? The answer was we do. That'd be super
we do.
Nice.
We learned that lesson a little too late, but here we are.
Like a whole aisle of the grocery store wouldn't even have to exist if that was a thing.
Yeah. And I would imagine there's also like a sense of like maybe you could like speed up your period. You'd be like, oh, I have a trip on Friday and I just started on Tuesday, but if I could just squeeze it really hard, then maybe I could just get it all out now.
Just like,
just like bring it out. And that way I could go on my trip and not have to worry about it, you know?
Yeah. Like I've got 2.5 days. Let's go.
Yeah. Yep, exactly. I don't have time for that. I'm getting married, you know, in a couple. I don't want to be on my period in that way. Although there have been some studies that have suggested that if you masturbate and if you allow yourself to orgasm while you're on your period, that it tends to shorten your cycle a little bit and it helps with cramps. So
definitely helps with cramps. That research is there. Interesting. Like it seems like you wouldn't shed your lining any faster, but I can see if you're orgasming and those muscular contractions are happening in your uterus, then you're getting like some interesting vasodilation and constriction going on. And that might change, how long your menses is. Yeah.
It's not going to like, you know, shorten it by like days and days and days, you know, but you might notice like, you know, like your last day or two might be a little bit lighter than like what you're used to, you know?
Oh, but India, if you're menstruating, like you can't put things up there or have sex or anything. Like that's just a complete like no-go zone for 7 days, right?
Yeah. I mean, why would you want to anyway? Because obviously like you pee out of that place. So who wants to stick anything up there? And poop out of there. Like, what is wrong with you?
Exactly. It's like a bird cloaca. Like it's all just coming down the same chute, like a freaking apartment building trash chute.
Exactly.
Oh my goodness.
I mean everything. Yeah. Well, for sure, right? They're not very, I will say, I think, thankfully, you know, we have started to see really cool developments in menstrual products over the past like decade or so when it comes to like Diva cups, menstrual cups, but particularly menstrual discs, which are my personal favorite. I think menstrual discs are the way of the future. I think they're incredible. I think they're so cool. But for any of our listeners who've never heard of them, they are kind of similar to like a menstrual cup, except they are like a lot wider, but they're squishy. So you can kind of like squish them down and insert them very similarly to how you would insert like a tampon. What's great about them is the learning curve compared to a menstrual cup is like way shorter because all you have to do is tuck it behind your cervix, and then you tuck it up behind your pelvic bone. So it kind of sits like at an angle within you, and it just kind of catches all of the menstrual blood. And they have ones that are reusable, they have ones that are disposable. So if you have a preference and you're like, I'll just keep cleaning it, or I'll just throw it out when I'm done with it. but they tend to hold a lot more capacity compared to like a tampon, a pad, menstrual cup. And they do allow for mess-free-ish period sex, which is great. So you can still have sex on your period, and you can still keep your menstrual disc in, so you don't have to worry about it, which is lovely. So I'm so glad that we have these products on the market now.
Yeah, it's been time. That's kind of ridiculous that it has only been in the last 10 or 15 years that those products have been available widely, especially since we've had like cervical caps and diaphragms and stuff like that for decades. Like, who was just thinking about keeping the sperm out? How about keeping the blood in safely?
That might be helpful.
Yeah, I do. That's fantastic. I also, I have recently, I would say within the last few weeks, had 2 discussions on the fact that you can indeed have sex with a woman who is on her period. It's not infectious. It's not weird. She's horny as hell because of her hormone stuff going on right now, by the way. So for sure, if you get over your own ew factor, you don't get laid. So maybe you should think of that. But yeah, I had a guy who was like, no, that's disgusting. And blood is unsterile and it's going to get in my pee hole. And I was like, what are you talking about? It is sterile. It just came out of her body. What are you the uterus is one of the most sterile places on the planet because
it has to house a baby.
It is this little itty bitty poke hole that frankly is closed almost all the time. So what are you talking about? And I was like, and if you're worried about it, then why don't you pee after sex? Right after she does. Send her to the bathroom, then you go pee, and everybody's good. Everybody's
happy.
Yeah.
Worst case scenario, practice safe sex and wear a condom.
There you go. Also,
shocker.
Okay, well then don't get laid.
I don't get much pleasure out of it. Well, do you know what tends to enhance pleasure? Safety. Feeling comfortable with your partner and your body tend to make things a little more pleasurable. I could be crazy, but
you are a little off kilter, India, and I am right there with you. And I enjoy where we are seated. It's perfect.
I think it's a lot more fun on this side of things. I think I've been on the other side. Way less fun. Way fewer cookies. All right, they don't have any good music over there. Nobody is having cool conversations. They're all in bed by 7 p.m. So I'm just like,
no glitter, no chicken wings.
Yeah, none of that.
I might just peek out the door every once in a while and then pull that shut. Yeah. No, thank you. No going back there.
Nope.
Girl, this has been so much fun. I have enjoyed getting to know you so much better.
Yes, me too. This is such a great conversation, and I'm so grateful to be able to share all of this and to explore all of it. And I just hope it helps all the people that it needs to help.
Oh, heck yeah. I'm going to get this out far and wide. I will get all the information to you so that you can share it and people can find you. Because this is fantastic information from a ton of people who are really probably dealing with shadows and sitting in the dark and not realizing there's a lot of other people out there who not only occupy your same space, but who have help for you and empathy for you. Put it out on the just put it out there. All your rusty stuff, your dirty stuff, all the weird shit you've left behind. Let's look at it on the table and sort it.
Yeah, absolutely. It's the only way to find your people, and once you find them, you really realize oh, this is really cool.
Yes. And they think so too. These are gifts for everybody.
Absolutely. Oh, thank you so much for having me.
It was my pleasure, India Johnson. Let's do it again.
Absolutely.